Welcome back to another episode of Learning. May I have your permission to begin this episode with a very short story? I met a young lady in her third year of the university, and she has been battling with itchy feeling or itchiness in her vagina. She has also been battling with foul, smelly discharge and burning sensation. And constantly, she has been blaming her school toilet. She has been saying it's because of the public toilet in her school. That is why she's having those symptoms. Welcome back, guys. And today we're going to be talking about how to handle toilet infections. But before I continue, hi. If you're just seeing this face for the first time, you're very welcome. My name is Pharmacist Ezinye Ugoke, and to my wonderful subscribers, I welcome you all. I am very loyal. Aww. Thank you for all the support you give to me. Well, in this channel, I teach health tips for young people, and I also teach content creation tips for YouTube beginners or people that are new to content creation. So just like my story earlier, there are a lot of young girls that are battling with this same issue and are wondering how to handle it. It might shock you to hear that toilet infection is not a medical term. In fact, studies have shown that people named it toilet infection just assumed that because these symptoms happen around the vagina, then probably they should be causing from the toilet. And today I'm here to tell you that those symptoms are not contracted from toilet seats. The right term for it is vaginitis or vulvovaginitis. So moving forward, we are not going to be using terms like toilet infection. I'm going to be saying more words like vaginitis. What are the causes of vaginitis? Vaginitis is usually caused by poor personal hygiene and poor sexual hygiene. Poor personal hygiene like douching. What is douching? It is very wrong to use soap to wash your vagina. This is the reason. Your vagina is made up of what we call good bacteria that helps to dominate the area to prevent bad bacteria from growing. This good bacteria is called lactobacillus. So in the process of using soap to wash your vagina, you tend up washing off this good bacteria. And if you wash off the good bacteria, automatically you are inviting the bad bacteria to increase in numbers. And if you do this, it would cause the symptoms you're having. Other things that can cause vaginitis include wearing underwears that can retain moisture for long, poor sexual hygiene like having unprotected intercourse, abuse of antibiotics. Yes, some persons have formed the habit of taking antibiotics even when it's not necessary, and sometimes they don't even complete the dose. These antibiotics, because the function is to kill bacteria, bad bacteria, if you abuse it, it tends to also affect the good bacteria that is meant to maintain the pH of your vagina, thereby leading to that burning sensation and itchy feeling. Also, foreign objects like your tampons, your sanitary pads, and spermicide can also cause irritation in the vagina. Research has actually shown that what are the common symptoms of vaginitis? Please subscribe to this channel to get more information like this. Thank you. We have burning sensation or burning feeling, itchy feeling, having the urge to constantly itch your vagina, abnormal discharge. This discharge depends on what is causing the vaginitis. For instance, if it's caused by outgrowth of bacteria, you tend to have green colored discharge that usually has foul smell or fish smell. That's bad smell. But if the vaginitis is caused by yeast infection, you tend to have whitish discharge that is usually thick, looks like expired milk, and it doesn't come with any smell. It doesn't have any smell. Vaginitis can be prevented by number one, Avoiding the use of underwears that can retain moisture. Avoid any form of unprotected sex because these bacteria can actually be transferred from one person to another through sexual intercourse. Avoid douching or avoid using soap to wash your vagina. Now, how can it be handled? Actually, there are a lot of drugs that you can use to handle it. Drugs such as metronidazole and clindamycin is used to manage bacterial vaginitis, that is vaginitis caused by bacterial growth. Also, antifungal drugs like clotrimazole or fluconazole can be used to manage vaginitis caused by fungal growth. It is best to visit your healthcare provider for proper diagnosis and treatment. Subscribe for more information. Bye.